Okay, now the consequences of this high sugar state of diabetes. Now you see there is no glucose going inside. The cells are starving. So they have to find out a way to get energy and start some functioning. So for this purpose, they start using alternative sources of fuel. Just like in the kitchen, when you run out of gas, run out of electricity, you start burning wood if you are in an emergency, or the papers to generate heat. The same way, the cells, they start breaking down, the body starts breaking down the proteins. They go as a source of energy because they don't need insulin. Same way, the fats are broken down, and the fats go as ketones inside the cells, and then they are broken down for the energy purpose. So the alternative sources of energy are used. As a consequence of that, and this is what gives it a name of diabetes, the patient starts losing weight. It's as if the patient is melting, and the diabetes means siphon. And the siphon is like the earlier definition of diabetes was like if the body is melting and excreting through the kidneys, like the body is siphoning through the kidney. And this was called diabetes mellitus, the disease in which the urine is sweet. Now that leads to a increased loss of weight, and this loss of weight is very prominent in the patients who have got insulin absolute insulin deficiency or the severe insulin deficiency, even in type 2 diabetes. This is type 1 diabetes. Usually their insulin level is very low as compared to the resistance of the entrance of the glucose inside the cells. These patients need insulin from the beginning. Second thing, the second complication is on top of the complication that has already happened for the previous 10, 15 years when the patient was in the hyperinsulinemic state. The hyperinsulinemia causes the vessels to become thickened. There is a deposition of cholesterol inside the vessels, and the lumen is narrow. And this can be precipitated by the cigarette smoking, because cigarette, what it does is it causes small injuries inside the lumen of the vessels. And these injuries, just like the flies sit on a wound, these injuries are a big magnet for the cholesterols, and the cholesterol accumulate on them. And this causes the thickening and narrowing of the vessels. And this thickening and the narrowing of the vessels usually manifests at three places. One place is actually four places. One place is the vessels, the peripheral vessels, which is called the peripheral vascular disease, in which the pulses to the feet, they become feeble or lost, their blood supply to the feet is reduced. Same way, there is thickening of the vessels and narrowing the vessels in the brain, and the thickening and narrowing of the coronary vessels. This is why the patients who have got diabetes more prone to develop heart attacks, diabetic foot, gangrenes, and the strokes. This and similar way it affects the vessels in the kidneys also, and the kidneys become there's a combination of different factors also. Kidneys start failing. Same way it causes this ischemic changes in the eyes, and when on top of the ischemic changes, you get this new vessel formation, and then there is a bleeding of the new vessels, and that causes the bleeding inside the retina of the patient, sometimes near the center of the vision. That's called a macula area. And then these patients can get blindness. That's why you need a laser treatment to reduce the ischemic zones. Now, these are the complications of the atherosclerosis and the thickening of the vessels secondary to the hyperinsulinemia. Now, this is the first mechanism of the complication of diabetes. The second mechanism of the complication of the diabetes is the glucose, which is high and circulating in the vessels, and it is not able to go inside the cells, slowly gets converted into toxins, which is sorbitol or the glycosylated proteins, just like the glycosylated hemoglobin, which gives you an indication of the level of severity of the diabetes. Now, these toxins with the glucose have got certain effects. These toxins, they can cause neuropathies. These toxins, when they accumulate at these in the nerves, they start affecting the longest nerves first. The longest goes from the brain to the feet, and these patients develop peripheral neuropathies. And these patients will have tingling sensations in the feet, and then they get burning feet, and then they start losing sensation in the feet, especially in the toes at the end of the end, and then they feel like walking on wool. This is one of the features. And then this toxicity also manifests in the kidneys. The kidney goes through different stages. The first stage, as I said, there's a lot of filtration, a lot of urine being peed out, and this causes this kidney to become bigger in size. The adhesions between the glomerulars, the basic unit of the kidney transport is the exchange material is the glomerulus. And then there is leaking of proteins through the kidneys. This is the hyperfiltration stage. Now, on top of that leaking stage, inside the kidney, these toxic the substances start accumulating. They accumulate as a translucent material. If you cut the kidney, see under the microscope, there's accumulation of translucent material. This is called Kimmel-Steele-Wilson's disease, amorphosis, an afflict substance. And eventually, this combination of hyperfiltration, atherosclerotic changes, and the deposition of this material, glucose toxicity material, they cause the kidney to start losing their function. The GFR starts dropping, creatinine starts increasing until you reach a stage when the kidney, you have got a chronic renal failure and the patient has to go to the dialysis state. Now, this is the problem in the kidneys. Eyes, I have already mentioned it. And now there is another factor on top of this atherosclerosis changes caused by hyperinsulinemia. You see, these toxic proteins and the high sugar level, when they are attached to the LDL, for the same level of cholesterol as compared to a normal, like a normal person has an LDL of 126 and a diabetic patient has an LDL level of 126, glucose toxin products attached LDL has got more closely packed LDL particles, and they are more dangerous and are more atherogenic as compared to the normal person. That's why in the diabetic patient, we want to keep it less than 100, maybe even 70 if there are other comorbidities, if the patient has got diabetes as compared to the normal LDL level. This is the mechanism in which the atherosclerosis, or the accumulation of fats inside the vessels, is accelerated in these patients. This is the second mechanism, the toxin product. The same thing is when there is hyperglycemia, it affects your neutrophils or the white blood cells. And these cells, which are living in hyperglycemic state, they are less able to fight the bacteria and the infections. And this combination, now there are combination of some things in the foot. The patient has got neuropathy, has got less sensation in the feet, is more prone to get injury, just something very trivial in the shoes or a nail or something. And then on top of that, he does not have sensations, he's very prone to get injured very quickly, and he has got atherosclerosis, the blood supply is not reaching the foot, which can cause a dry gangrene, or as a consequence of infection can cause a wet gangrene. And the WBCs, the white cells, are unable to fight off that infection. And this may end up in a diabetic foot, and it may end up in amputation of the limb or a foot. This is the other complication caused by the diabetes and the foot. I'm talking about the major complications. The other complication that is very important is, which is patients are like shy to talk about it, but it's very important, is a sexual dysfunction. Sexual dysfunction is very common in diabetics, especially who have got uncontrolled diabetes, and it is a combination of certain things. First thing is that there is a neuropathy, autonomic neuropathy, atherosclerosis, and all these combined. And sometimes on top of that, there is depression also, and there is testosterone deficiency also. All these factors combine, and they lead to the impotence in these patients. So you have uh, uh, to figure out which element is contributing most to this person's sexual dysfunction and have to address them. But it's a multifactorial thing. The other thing is depression in the patients with the diabetes. Depression is very common in the diabetics, and no direct relation has been postulated out yet, but it is very common, and it can lead to certain things. Especially if the patient is depressed, he will not be compliant with the medication. He's more prone to smoking. So he's going to damage himself more. So depression also needs to be addressed in the patient who has the diabetes. Thank you. Then next time we'll discuss these things further.